Dr. Joemoleski here. I want to show you how easy it is to inject these weight loss peptides once weekly. So first off, you're going to get a package that's insulated like this. It keeps the peptides cold, and when you get it, it seems kind of like foam and inflated, but that's normal. What you're going to do is after you open the package, you're going to put it in the refrigerator. These peptides can live at room temperature. So if you get it in the bottles, not necessarily cold, it's still fine. So let me get into it. Let's start. Number one, unboxing the peptides. So after opening the packaging, you're going to see that there's an ice brick and just a foam insulation. You're going to discard that, but let's get into the details. You're going to get into what's most important is the peptides. It comes in a refrigerated envelope here, and what you're going to do is you're going to get alcohol prep pads. You're going to get a bottle that has the medication in it. You're going to get a package of needles to inject, and then you're going to get some instructions, okay? So it's really simple, okay? You're going to open up the medicine bottle, and you're going to take out the small bottle, which contains the weight loss medication, the Ozempic or Mounjaro, also known as semaglutide tirzepatide. And you're going to take this little top part off, which is just a protective covering. And then you're going to open up the alcohol prep pad, which is just a cleaner. You're going to clean the top. And then you're going to get your needle ready. So this package of needles, there should be 10 or 12. You do one injection once weekly, okay? And so the next step is to draw up the medication. So I want to tell everybody to stop at this stage. You got your bottle cleaned off, you got your needle, you need to stop. And I get this question a lot. You're going to look at the instructions, okay? Now, the instructions should be in a little card with your name on it, just like you would get from every other prescription, or they're going to be on the bottle, okay? So you're going to stop what you're doing, look at the bottle. And what it's going to say on the bottle, obviously it has your name, but right below, it's going to have the name of the medication. And so the name of the medication either being semaglutide or tirzepatide, and then right below it, it's going to say what you inject, how many units. So it says on this prescription, it says inject 50 units once weekly. Now, as I said, this is going to be different for everybody. So not everybody's going to be injecting, 12 units, 25, 50, 100. Everything is different. So you need to look at your specific label on your medicine bottle, okay? That's where the instructions are at. So you're not taking any advice from this video on how many units to inject. You need to refer to your own prescription. What I can tell you is most patients, if they're starting out with me, they are on the tirzepatide. That's what I recommend, and it's 12 units. The second month is typically 25 units. The third month, it depends. It's 25 units or 38 units, and then it can go up to 50 units. So that's the stepwise progression in dosing, but everybody's different, and you need to refer, once again, to your label or your little insert that comes in your package that says your name, the medication name, and then right underneath, it will say inject blank units. And so let's get into it. I'm going to just show you how to draw it up, okay? And so what you're going to do is first grab your needle. We've already cleaned it off, but I'll clean it off again. And then you're going to uncap the needle. Now this needle is very small, okay? So it can bend and you have to be careful. So then you're going to, in one hand, you're going to hold the needle. The other hand, you're going to hold the vial. And what you're going to do is just like this. You're going to, with both hands, inject. Okay, so see how I'm still holding it? And then you're going to pull down slowly. Okay, so you're going to pull down slowly to whatever it says on your medicine bottle. Okay, whether it's 12 units or 25 units or 50 units, whatever the medicine bottle says, that's what you do. So you're going to draw it down, and then what you're going to do is go like that. Okay, separate the two. Now take the vial, put it down, and you have your medication drawn up to inject. You really want to make sure that there's no bubbles. So you want to make sure that you give it a little push and there's a little medication that squirts out on the top. That's normal. You just want to make sure there's no air. If there is a small little bubble of air, it's fine. It's not going to hurt anything. Okay. Next is you're ready to inject, which these medications are injected into a fatty area of your body, whether it be the back of your arm, your hip, your thigh, your inner thigh, your buttock, whatever it is, your abdomen, which is the most preferred site. You pick what site. So the next step is injecting. So you're going to take an alcohol prep pad. This is the cleaner, we'll call it, for the top of the bottle and your skin. And what you're going to do is take the alcohol prep pad and you're going to clean. Okay, so if you're going to do your abdomen on the right side or left side of your belly, you're going to clean your abdomen off. All right, let it dry. Then you're going to take the needle. You're going to squeeze a part of your abdomen where there's a fatty tissue, and then you're going to go 1, 2, 3, inject. Okay, and then you're going to push the plunger down all the way and then remove the needle. It's really that simple. And then the medication lasts for a week in your body. So you want to plan on giving that injection the same time the following week. So if you inject on a Sunday at 5 o'clock, you're going to inject on the Sunday at 5 o'clock throughout the month every week. So that's the basics of how to inject these weight loss peptides. If you have any questions, you can reach out through our link through Tibra and ask any questions. We're happy to help. But that's just basically how you inject these weight loss peptides. Hope that helps.